Today, we are going to demonstrate the correct techniques on the assessment of the abdomen. The purpose of this assessment of the abdomen is to evaluate the learner's performance on the use of correct techniques in performing a thorough physical assessment and to differentiate normal from abnormal findings of the abdomen. And for the materials needed for this assessment of the abdomen are small pillow, a centimeter ruler, stethoscope with diaphragm and bell, and a marking pen. The steps on the assessment of the abdomen. And now we are ready for the assessment of the abdomen. So first, we have to perform hand washing. So this time, we are going to disinfect our hands with a sanitizer or an alcohol. Then second, we are to gather the materials needed. Then third, we have to explain the procedure to the client. And fourth, we are to ask the client to put on a gown. And now we are ready to assess the abdomen of our client. And to begin with, we are to inspect the skin, noting the color, vascularity, stria, scars, and lesions. And take note to always wear gloves when we are inspecting for any lesions. Inspect the umbilicus, noting color, location, and contour. Then inspect the contour of the abdomen. Look across the abdomen at eye level from the client's side, from behind the client's head, and from the foot of the bed. Inspect the contour of the abdomen. Look across the abdomen at eye level from the client's side, from behind the client's head, and from the foot of the bed. Inspect the symmetry of the abdomen. Then look at the client's abdomen as he lies in a relaxed supine position. Then inspect abdominal movement, noting respiratory movement, aortic pulsations, and or peristaltic waves. Okay. Now we are ready to auscultate the abdomen. So, auscultate for bowel sounds, noting intensity, pitch, and frequency. Use the diaphragm of the stethoscope and make sure that it is warm before you place it on the client's abdomen. Begin in the right lower quadrant and proceed clockwise, covering all the quadrants. Conform bowel sounds in each quadrant. Listen up to 5 minutes, minimum of 1 minute, to confirm the absence of bowel sounds. Then, auscultate for vascular sounds by using the bell of the stethoscope to listen for bruits over the abdominal aorta and renal, iliac, and femoral arteries. Then auscultate for friction rub over the liver and spleen. Listen over the right and lower rib cage with the diaphragm of the stethoscope. Percuss the abdomen for tone. Lightly and systematically percuss all quadrants. Abdominal percussion may proceed clockwise or up and down over the abdomen. Percuss the span or height of liver by determining its lower and upper borders. To assess the lower border, begin in the right lower quadrant at the mid-clavicular line and percuss upward. Note the change from tympany to dullness. Mark this point. It is the lower border of the liver dullness. Now to assess the descent of the liver, ask the client to take a deep breath and hold. Then repeat the procedure.
Sir, agang mas katinolan.
Remind the client to exhale after percussing.
Agang mas cancer.
Now to assess the upper border, percuss over the upper right chest at the mid-clavicular line and percuss downward. Noting the change from lung resonance to liver dullness. Mark this point. It is the upper border of liver dullness. Measure the distance between the two marks. This is the span of the liver. Repeat percussion of the liver at the mid-sternal line. Be reminded that the normal liver span at the mid-sternal line is 4 to 8 centimeters. Percuss the spleen. Begin posterior to the left mid-axillary line, or the MAL, and percuss downward. Noting the change from lung resonance to splenic dullness. A second method for detecting splenic enlargement is to percuss the last left intercostal space at the anterior axillary line while the client takes a deep breath.
Agang mas katinolan, sir.
Perform blunt percussion on the liver and the kidneys. This is to assess for tenderness in difficult to palpate structures. Percuss the liver by placing your left hand flat against the lower right anterior rib cage. Use the ulnar side of your right fist to strike your
Sir,
left
bagam na
hand.
masakit.
Perform blunt percussion on the kidneys at the costovertebral angles over the 12th rib.
Sir, bagam na masakit.
Perform light palpation noting tenderness or guarding in all quadrants. Light palpation is used to identify areas of tenderness and muscular resistance. Using the fingertips, begin palpation in a non-tender quadrant and compress to a depth of 1 centimeter in a dipping motion. Then gently lift the fingers and move to the next area. To minimize the client's voluntary guarding, a tensing or rigidity of the abdominal muscles, usually involving the entire abdomen. Keep in mind
Sir,
that the
ganun
rectus abdominis muscle relaxes on expiration. Deeply palpate all quadrants to delineate abdominal organs and to detect subtle masses. Using the palmar surface of the fingers, compress to a maximum depth about 5 to 6 centimeters. Perform by manual palpation if you encounter resistance or to assess deeper structures. Palpate for masses, note their location, size in centimeters, shape, consistency, demarcation, pulsatility, tenderness, and mobility. Do not confuse a mass with an organ or structure. Palpate the umbilicus and surrounding area for swelling, bulges, or masses. Then palpate the aorta. Use your thumb and first finger or use 2 hands and palpate deeply in the epigastrium, slightly to the left of midline. Then assess the pulsation of the abdominal aorta. Then we are going to palpate the liver. I have to palpate the liver, noting consistency and tenderness. To palpate by manually, you stand at the client's right side and place your left hand under the client's back at the level of the 11th to 12th ribs. Lay your right hand parallel to the right costal margin, so your fingertips should point toward the client's head. Ask the client to inhale,
Sir,
then compress upward and inward with your fingers. To palpate by hooking, stand to the right of the client's chest, curl or hook the fingers of both hands over the edge of the right costal margin. Ask the client to take a deep breath and gently but firmly pull inward and upward with your fingers.
Sir, gamas ka tinaunog.
Palpate the spleen, noting consistency and tenderness. Stand at the client's right side. Reach over the abdomen with your left hand or left arm and place your hand under the posterior lower ribs. Pull up gently. Place your right hand below the left costal margin with the fingers pointing toward the client's head. Ask the client to inhale
Gamas ka naunog, sir.
and press inward and upward as you provide support with your other hand. Alternatively, asking the client to turn onto the right side may facilitate splenic palpation by moving the spleen downward and forward. Document the size of the spleen in centimeters below the left costal margin. Note consistency and tenderness. And now we are ready to palpate the kidneys. To palpate the right kidney, support the right posterior flank with your left hand and place your right hand in the right upper quadrant just below the costal margin at the mid-clavicular line. To capture the kidney, ask the client to inhale.
Sir, agamas ka?
Then compress your fingers deeply during peak inspiration. Ask the client to exhale and hold the breath briefly.
And hold breath, sir.
Gradually release the pressure of your right hand. If you captured the kidney, you will feel it slip beneath your fingers. To palpate the left kidney, reverse the procedure. Palpate the urinary bladder. Palpate for a distended bladder with the client's history or other findings warrant. Like for example, a dark percussion noted over the symphysis pubis. Now we are to begin at the symphysis pubis and move upward and outward to estimate bladder borders.
For the special abdominal test, we are going to test for ascites. Perform the test for shifting dullness. The client should remain supine. Percuss the flanks from the bed upward toward the umbilicus. Note the change from dullness to tympany and mark this spot. Now help the client turn onto the side.
Side ka nga natin. Sir.
Mark the level where dullness changes to tympany. Perform the fluid wave test. The client should remain supine. You will need assistance with this test. Ask the client or an assistant to place the ulnar side of the hand and the lateral side of the forearm firmly along the midline of the abdomen.
Sir, ikabil mo dati imam ititing nga dito inti buksit mo. Dito kasla-kas to, sir.
Firmly place the palmar surface of your fingers and hand against one of the sides of the client's abdomen. Use your other hand to tap the opposite side of the abdominal wall. Perform the ballotment test. For the single hand method, using a tapping or bouncing motion of the finger pads over the abdominal wall, feel for a floating mass. For the bimanual method, place one hand under the flank and push the anterior abdominal wall with the other hand. Perform the test for appendicitis, rebound tenderness, and Robsing sign. Palpate deeply in the abdomen where the client has pain, then suddenly release pressure.
Sir, dito sa gitna. Sir, arik na mga sakit.
Listen and watch for the client's expression of pain and ask the client to describe which hurt more, the pressing in or the releasing, and where on the abdomen the pain occurred. For the referred rebound tenderness, palpate deeply in the lower left quadrant and quickly release pressure. For the psoas sign, raise the client's leg from the hip and place your hand on the lower thigh. Ask the client to try to keep the leg elevated as you apply pressure downward against the lower thigh. For the obturator sign, support the client's right knee and ankle. Flex the hip and the knee and rotate the leg internally and externally.
internal, external.
For the hypersensitivity test, stroke the abdomen with a sharp object or grasp a fold of skin with your thumb and index finger and quickly let go. Do this several times along the abdominal wall. Perform the test for cholecystitis or the Murphy's sign. Assess right upper quadrant pain or tenderness, which may signal cholecystitis or inflammation of the gallbladder. Press your fingertips under the liver border at the right costal margin and ask the client to inhale deeply.
Sir, agamas ka tinaunog.
Then, perform hand hygiene. Then validate and document findings.